together a couple of things that happened that's going to allow us to come up with approximately half of this amount of money. We had another project scheduled, and certain aspects of that, we've had to put that on hold for a while, so we freed up this money to be able to use somewhere else. When we heard about the MRI need, we got to looking at it, so all the positives of doing it. And from our board standpoint, we've always had to focus. We fund or partially fund about 11 different agencies here in the county. But our number one goal and number one priority has always got to be the hospital. Without the hospital here in Blount County, our economic development has almost ceased to exist. It's so much a bigger part of it. I put the hospital and education right on the same level as far as attracting people to the county. But more than that, it's serving the people of Blount County. So our board, we haven't taken an official final vote on it because we can't do it until we know we've got the funding for the whole thing. But our board's committed to doing this, bringing the MRI on the board. And Greg makes some really good points, and I wholeheartedly agree with him and our board. I think it would be a major step in the right direction, giving our hospital another avenue to, and be quite honest, bottom line is that hospitals have to make money to keep staying in business, and the better we can give them the ability to do that, the better we are.
So, Mary, you feel like the healthcare authority could do something close to 50% of the cost of this, something like that? So that would be a partnership that would really stretch everyone's dollar. To enter that. Now, I understand that there's ongoing cost to maintaining this type of machine, and that would be something that would be borne by the hospital.
The hospital.
And then
we would have to hire 3 FTEs, because the machine would be available 24/7, 365. Currently, we don't have that. It's available 8 hours a day, 3 days a week. So if you have a stroke, and we have this machine, no matter when you come in, you can be scanned, and the thrombability can be started.
one of the things that really impressed me in one of our previous advisory meetings was the testimonial given by Mr. Clyde Woods. And Clyde was the executive director of our Upstart Economic Development Council when he suffered a debilitating stroke. And he really talked about the importance of that and the fact that it took another hour for him to get to Birmingham to get that. We didn't think Clyde would live. He did, thankfully, and gives testimony to that. I've never been in an MRI machine. I'm afraid I would have to be heavily sedated to do that, especially in that small bore. But Greg, you mentioned this being a large bore machine. If I understand it, that would set us apart somewhat from maybe our neighbors, so that people of a larger body build or people that were claustrophobic of the smaller tube would have an easier time. And so we might be a focus point of neighbors around the periphery of our county coming here rather than going somewhere else. Am I understanding that correct?
You're correct. I'm one of those people, if I have to have an MRI, I'm calling to find if it's got an open bore or a large bore. Because literally I wear the thing when I get into it. I'm at the limit of what will fit in that tube. The large bore, if you ever had a CT scan, it's a lot like a CT scan. It's a big oval space that you're in. It's like you're laying in a little sports car instead of in a sewage tube, more or less.
Mr. Chairman,
Yes, sir.
I've talked to numerous people in the county that have had to go other places, including myself. You mentioned earlier about an arm or something like that. I had to go home with it. I think you had to go to the court for what you had. And it's just time after time after time, you continue to hear these stories about having to go down there and wait and then turn around and go back or something, and this, that, and the other. The more services that we get to where we can offer here in Blount County, the better off we are. Our population is continuing to age, and strokes are an everyday issue here in Blount County. And as Greg mentioned, it's way you can find out is to have the equipment to determine. And it keeps them from having to go to Birmingham and spend all that time down there and, you know, find out they didn't have one, it didn't need to be down there anyway.
So, gentlemen, we're, again, as I said earlier, we're not here today to make a decision. We're here to get our decisions kind of on the table. Y'all have any questions? Any of y'all ever had an MRI?
I've had several.
Have you?
I do have a question. You spoke about having to send people out of the county. Does, if y'all was to get one, would there be doctors holding clinicals much like y'all do at Gardendale? Because that's where I travel to. It's like 20 minutes for me to go to Gardendale, St. Vincent.
Yeah, this would open up a whole new group of physicians that would come to Blount County.
So like I think 2 or 3 days a week to have clinicals where it'd be orthopedic or whatever down there. So it'd be much like that.
We just need the equipment to be able to offer something like that.
Greg, you might explain it sounded like it's substantial investment has to go to preparing the place in the hospital. Would you elaborate on that just a little bit?
Yeah, the magnet itself weighs about 10,000 pounds, so it has to be in part of the hospital that will hold it, because we don't want it to end up in the basement. We do have a spot in the back of the hospital. It's the old employee lounge. It's on solid earth and there's nothing under it. The room used to be lead lined, it's copper lined now. So it'll be the most expensive wall stuff in the county. It's like 2-inch thick copper. That keeps metal objects from coming through the wall when the magnet's turned on. So that has to be done. There has to be a cooling system put in as the magnet gets very hot. It has to be an exhaust system because it gives off fumes. So all that has to be done before the MRI will work.
So, if anyone else in our audience would have a question, you're welcome to raise that. Yes, sir, Mr.
In regard to the point that he made earlier about sending Blount County into other areas that are more densely populated with COVID patients, for the sake of educating us on how this will help COVID patients potentially, is there anything that you can add in addition to what you just said?
Well, you're going to have changes with lung tissue with COVID. You're also going to have changes with heart tissue with COVID, or potential changes. This would help diagnose that.
That's important to recognize because of the source of the funds. I believe that in and of itself would justify the legal threshold that I think will ultimately come out when the rules are finalized.
And we've seen full system changes: kidneys, liver, lungs, heart, brain, from the effects of COVID. Everybody reacts differently. But my concern, because we're trying to give out vaccines and no one wants them, is you go down to get an MRI at one of the St. Vincent's facilities or Birmingham, you probably have 10 times this amount of people in the waiting room alone. So if you don't have to leave the county and go down amongst people that you don't know are vaccinated or not, this is a good option.
So Scott, if Mr. Brown were to draft a letter of request, if he could incorporate those kind of facts into that, would that?
Yes, sir. I think it's imperative, in addition to all the other things that he's identified, I think it's imperative that he identified those in the first couple of paragraphs, because that is the basis upon which any governmental entity in the state right now is advised to provide those funds. Those kind of projects must relate back to the immediate needs related to COVID-19.
Mayor?
Yes, I just wanted to add that, even though earlier I mentioned about having St. Vincent's, the machine itself really does quite a bit of people in Blount County. And one of the ways that we ensure that happens for a long period of time is the healthcare authority has bought equipment, purchased equipment, and put into the hospital multiple times since I was elected chairman. And we have a procedure that ensures that piece of equipment never leaves Blount County.
Any questions, guys?
Mayor,
Comment
I
today?
have a question. I understand that this could be a partnership between us, and I understand that we got stuff's got to happen in the hospital, which I think the hospital is actually taking care of that part with the employees. So the hospital board could help up 50% of this other. But just say if the county commission could release the funds for the machine, and it's going to increase the amount of people that's coming to that hospital, we have some efficiency on the building. We don't have an entrance down in the bottom, a covered entrance for the elderly people. There's a lot more that needs to be handled in the situation. That would free the hospital board up to take care of those items if we could fund the machine total. Is that not true?
Oh, absolutely. Well, to be quite honest with you, that's where we were looking at diverting money. We were looking at what's the most pressing issue right now. And you hit on something that we've all discussed through our board and a lot of the people in the county about needing a covered place downstairs where they unload people that's in wheelchairs and all that kind of stuff. Mr. Brown and I have worked on that. We've got engineers already paid for the drawings and the engineering work on having that done. And that's the project that we had decided we were going to have to kick down the road a little bit because this one was such a high priority. Now, the hospital had agreed to do a shuttle in the meantime before you get the covered parking down there in case somebody has to park off. But it still doesn't really help address the having to get wheelchairs out in the rain. So the drawings and all that we've got is to put a portico out there, kind of like it is upstairs, not quite that fancy. But yes, if the more that the commission can pick up, the more we can spend on doing that.
I just see it all working together with the elderly people of the county.
It does, they're all connected.
Yeah, when you look at the end of the day, it's how convenient can the elderly get to the point of being where they need to get everything took care of.
I agree 100%, and that's the main point of all of this, is it's not really about thing business, it's not about the healthcare authority, it's about the people in the county.
That's all I have.
John, your hand went up.
Yes, sir, I'd like to speak on that. Y'all all know I got liver failure on the transplant list. They found my problem down here at they carried me out to the trailer he's talking about, and they found it out there. They were helping people a lot. They told me I had to go and work for the treatment. But they did find it down there. That's a good thing.
Well, thank you, John, and you know that this commission's best wishes are with you, and we're for you, and continued treatment, and we hope for a great outcome to what you're going through.
It's just one of them things, like a nightmare. I'm 57 years old, never drank a drop in my life, nothing. I got this. It happened to me, it happened to anybody. They go to the hospital, they help me.
Thank you, John. Another hand went up, ma'am. Ms. Ford, I'll recognize you next.
I have a question. You say you spent $312,000 a year to rent the machine. You're getting a refurbished machine for $800,000. What is the life expectancy of that refurbished? And what kind of warranty?
25 years.
25 years? And what warranty?
If it's stationary. If it's traveling up and down the road, that cuts splice.
No, I'm saying on this refurbished, you have any kind of warranty, like if it breaks down in the first 5 years or
Yes. I think it's a 3-year warranty.
3 years, and it's supposed to last 25.
And then Ascension has its own biomed group that would come and take care of it.
Is there a cost to y'all for that?
Yeah, they're contracted.
And then the 3 people though, as I understand you told the commissioners, that's not included in this 1.5.
No, that would come out of our salaries and benefits through
Who
Ascension.
operates it now? Is that part of the 312,000?
Yeah, they give us 2 techs, 8 hours a day, 3 days a week. They also cover any type of breakage. You're welcome.
Ms. Ford, you had a question?
Well, I was just gonna say that I've had an MRI just a week ago, and it was in Gardendale. It took me all of 20 minutes to get there, and I was out of it within a half an hour and back home, and I think that this ought to be available with the time frame for everybody in the county. It was easy for me to get there. It wasn't fun getting the injection, but what I want to say is I think everybody within our county needs to have an opportunity to be able to get and have their medical work done quickly as possible.
Thank you. Mayor, did you have another one?
Yes,
Thank you,
I'd
Ms.
like
Ford.
to add to this lady's question back here about the cost of Greg jump in and stating something. I don't like to get into what St. Vincent's is going to spend, but that, what he's talking about as far as operation machine employees and all that, that's only a portion of the cost. As time goes on, as everybody knows, electronics equipment and all that, you have upgrades. And we're projecting, what, about 5 years on normal upgrading the components and all that.
Software upgrades are usually every 3 to 5 years.
Yeah, that's normally about, what, 200,000?
Depending on the piece of equipment.
Somewhere in the neighborhood of 200,000. So over a 25-year period, that has St. Vincent's or Essentials having another major investment that's fixing equipment.
Okay, well, I know we got a lot of other things we want to just throw out there. Greg, do you have any concluding remarks?
I've got one thing to show you how large our elderly population is here. We're unique in the other Ascension hospitals and UAB, which we have an alliance with now. They run around 60% Medicare. My Medicare population is 89% of everything comes through the door.
How much?
89%. It's been as low as 88%, but we usually hit 89% on a monthly basis. So we are dealing with an elderly population, and for them to have to go into Birmingham, it's a day trip.
Okay, gentlemen, any further questions before we move on?
Thank you.
If not, Greg, thank you so much for coming. Mayor, thank you for being here. We appreciate everybody's input. And if you would, Greg, if you could put your request into writing and incorporate some language suggested by our county attorney, then we'll have it on file.
So you want it dripping with COVID?
Yeah. Thank you.
Commissioner, do you think of anything else?
No, sir, I don't. Thank you so much.
Thank y'all.
Yeah, thank you so much. Gentlemen, we have representing our sheriff department, Captain Adkins, that's here, and Sheriff, I don't think is available today, and he did send a letter, and Captain Adkins is his representative here today. We put that letter in the folders. We just got it in the email late yesterday.
The last.
So, Captain, do you want to address any of these issues and run through them right quick? And
Yes, sir, if I may.
you certainly may. Come
Can I
forward.
approach the bench
Certainly.
or the podium? Thank you. Good morning, Judge, Commissioner.
Good morning.
All County Governor. We sent this letter, the sheriff put this document together yesterday, and there was a number of topics. I know that I understand now the premise of the meeting, so I won't go deep into them, but there's some notes there that could make everybody understand what we're trying to get across. The first one on the sheriff's list is the 911 digital radio system. The underserved, unincorporated areas of Blount County and remote municipalities lack entirely in our present emergency communication contact system. Some of them lack entirely, some of them lack partially, but there is a vast amount of dead spots that's isolated to the outer fringes of the county and in some of the portions that's in the mountainous areas. This project's already underway, and the cost of this project is $2.3 million. However, due to this cost, we can expect it to take over a year to implement. And under the existing plan that's already underway, our vehicle-mounted and handheld radios will most likely be leased by many, if not all, full-time and volunteer first responders. I'm not here to speak on behalf of 911. I talked to 911 this morning. What I'm speaking on is behalf of law enforcement and hopefully all first responders that need these radio systems. And what we're hoping for is that under the American Rescue Act, that not pay for the system in entirety, but pick up the bill where we could put this system into incorporation a whole lot quicker than 1 year down the road. I believe the municipalities are going to be asked to share from their Rescue Act funds in this system. 911 has already put forth a system. We would just like to put this on the commission's radar And I think it's a worthy cause. I think that, all, the former gentleman said, all Blount counties are gonna respond to this. A good example would be the shooting that took place, 3 weeks ago on the other side of the highway down 65. None of our guys can talk. There's a raging gun battle, people are dying, and nobody can talk. So, and then two, we had to, I think it was 3 or 4 years ago, we had to leave Verizon because of the same problem. So we went to AT&T. And even with AT&T, there's some dead spots. So in the midst of some real emergency, whether it be a medical emergency, a gun battle, chasing chasing convicts or what have you, criminals across the county, and getting people out of the way, there's no way for us to do that in these dead spots unless we're doing it on cell phone. And a deputy in a chase at 85 miles an hour down 160 trying to use a cell phone is not a good idea. Or fighting for his life on the other side of the 65 highway. So we wanted to bring that to your attention. There's these underserved, I put down here, this digital system will enormously enhance our communication capabilities for all first responders and remove the dead spaces we have in many underserved locations in our county. It ties into the corona or the COVID acts, and we can do that in several different ways, but when people need help, they need help. And we think that this is a good cause. We'd like you to just consider that. Any questions on that? I'm trying to be fast here.
Thank you.
I have a question on 2.3 million. Is that just for the system, or is that with the, is that figured in with the volunteer fire departments for all the radios?
That's the whole system, to my understanding, which I believe is correct, that's the whole system in entirety. That means that all these departments would not have to lease vehicle radios, they wouldn't have to lease their handhelds, all their radios would work. This digital system most of the state has gone around through some of that, and it's a good system.
And that's the sheriff's department's radios too?
Oh, yes.
Y'all's
sir.
cars.
Yeah, we're gonna have to lease them. If we go under the existing program right now, we're gonna have to lease all the handheld radios for the deputies and all the vehicle mounted radios for the deputies. That's something we really don't wanna do, and if we have the means available, or even a portion of the means available that can help out with this, we would like to see that happen.
One thing I would like to see, from 911 would be projected coverage areas that they pick up, because like you said, I know exactly what you're talking about. And along the County Road 5, Mill Creek, Poplar, Philpott, back in Bangor, you know, that's my worst coverage areas, the backside of 9. So,
Yes, sir.
like I said, that's one thing I'd like to see from 911.
All down 26 and mine,
Right.
down towards Garden City.
West of Bluffsville.
Yeah, I'd like to see a projected coverage where they're gaining. We're probably 85% right now, I think.
You know, I talked to 911 before I left this morning, but, and Neil Brooks is not here, and I talked to Brandon.
Let me state that, Neil, I had a text message change with Neil yesterday, and he's out of state, I understand, so I didn't press it to come to the meeting, of course. When I learned that, I just didn't say anything further.
Well, but I think Commissioner Armstrong's got a good idea. If they could project a county map and show in red where the coverage is not, and tell us that coverage is gonna work, I think that would be a good, I think it would be a good justification to show use for the money.
And if we're sitting at 85% coverage and we only pick up 5%, spending that much money, I don't see 5% work.
Well, at the end of the day, 911's done went to the system.
Right.
I think the question is, how much do we want to help?
Exactly.
Because it's going to put our volunteer fire departments in a situation,
Yeah, I mean, it's gonna
along
hurt
with the
them
sheriff's
worse.
department. So,
Yeah.
at the end of the day, they done made their decision.
Well, my question.
Showing us the areas is great, but I think it's just more or less is good information for y'all.
Right.
Other than that, we got a system in place, or it's coming.
Yeah, well, it's coming.
You know,
Yeah, it's coming.
And this is for Scott and Jeff, but are we sure that we can even help with that?
Well, We'd have to divert that to the.
Now, kind of where we are, a lot of these things we're talking about in a preliminary investigation of the interim rule, I think will work. But what I want to do is caution y'all and everyone to kind of tap the brakes just a little bit until the final rule is released. And
That's by U.S. Treasury.
yes, sir. And as Scott said earlier, a lot of things on our list, I think absolutely go to the heart of what the legislation is all about. I really do, and I think this is a worthy endeavor as well, and we can also participate. However, I wouldn't anticipate the Treasury Department going backwards. I mean, removing things from the list. I would anticipate things being added to the list, really, in clarifying and making it clearer for everyone to understand. Which I'm, talking about the federal government trying to be clearer and more understanding. I don't know if that's going to happen, but I would anticipate a clear definition of what we can or can't do.
Judge, I agree with Jeff in total, and in addition to that, the method in which it's implemented is important, like the questions regarding the MRI. Is the right recipient the healthcare authority or the hospital Ascension, or in this situation, is the right recipient 911 or all the various separate entities themselves? I lean toward that, but so the right makeup of what you ultimately decide will be determined by the final rules, and the implementing it correctly is critical.
Right.
And so,
Scott, could I say for just clarification to further for the general public is that what we have and what's being referred to as the interim rule is when this money began to flow, U.S. Treasury issued an interim rule that's almost 200 pages long. And then they went into a public comment period that I think will expire maybe toward the end of this month.
July 9th.
Last Friday.
It was, okay. So they will, sometime in the future, we hope in the very near future, they will issue the final rule. And so that's what we're referring to as to being sure we have the final guidelines once
Correct.
they release those on how we can and cannot spend the money.
I don't know that I could hazard a guess of how many comments were added, but you're talking about probably 3,500 county or county equivalents in the country, and maybe 75 or 80,000 municipalities that are participating in this program. So I would imagine tens of thousands of comments to be sorted through by Treasury.
The current rules proposed are thick with proposed uses like what's being discussed now. And so we can only assume at this point. We don't like to assume yet, but nevertheless, that, and again, repeating myself, it goes back to the implementation, the proper implementation of it, and to avoid findings in the future.
Well, and I know you can't, everything that's said on the news, not necessarily a fact. I understand that. So let me quantify what I'm fixing to say by saying that. But some of you might have noticed there was a brief ABC 3340 news clip this week that said that Shelby County committed $8 million to the communication system down there. And the first thing I thought was, how did they do that before a final rule is implemented?
You're exactly right. This is happening all over the state and elsewhere. Commitments, what we consider premature commitments, outright commitments. Having brainstorming sessions like this to get an idea of where you plan to distribute the proceeds, that's very important because you can hit the ground running when the time comes. But we would love to see the final rules before we advise you final time.
Okay. Guys, anything else about
I got
communication?
one more question here. You talked about the 2.3 million, but then you said the other municipalities will be asked to help. Do you have a number that,
No, I cannot speak for any municipality. However, that 2.3 million is a total. I know that 911, after discussions this morning, they're gonna take a portion of that. We hope the municipalities will take a portion from their American Rescue Act funds, and then whatever we can fill in, anything to move that ball forward, if it falls under ultimately the rule.
Is that system, excuse the question, but is that system proposed to increase quality in addition to
Yes.
scope of coverage?
Yes, sir. 100% quality. What we got now is analog. I don't know when analog came out, but it was a long time ago, and that's what we've had. And I know that 911, I think I was overseas, so I think during that time they refurbished the towers in order to try to get, we're in the foothills of the Appalachians, so that's always a communication problem right there with the analog device. So I think that they spent money to refurbish the towers, but in the remote areas of the county, it's not working. Probably, you had comments from District 2 and District 3 commissioners, but there's probably some spots in 3 and 4 that we have trouble getting at.
District 1 and 2, yeah.
1 and 2, I'm sorry.
Right. Okay, it's my understanding that we become part of a statewide system if that gets implemented. Do you have knowledge of that,
Yes,
Captain?
sir.
Okay. I think we've had some other inquiries about this in a couple of meetings. Again, I think we're becoming more and more aware of what this need is. So I think we're good there. If there's not any other questions, we'll move on to your next topic.
Did
Yes,
I
ma'am.
understand you to say that this 2.3 million would cover phones for all law enforcement and all firefighters?
I'm sure it will cover the ambulances, everything, all first responders.
So the departments would not have to spend that
Right.
$20 a month rental fee?
Right. Exactly. That's per item, whatever that money is. I didn't know how much it was.
Per phone?
And that's the problem I have with the system, but we know that at some point, they cannot afford that. They're volunteers.
Sure, yeah.
So that's where the burden comes up on the commission. But also that, within the next 5 years, there won't be no analog. They're trying to weed that out, so, we're facing this regardless, one way or the other.
Yep. That's very correct.
Okay, any other questions, guys, about that topic? If not, you can move on, Captain.
Okay, the way that we do things in the jail is it's called a jail management system. Currently, it's under Southern Software, the JMS. The jail needs an updated jail management system and a tool that can make officers more efficient, reduce risk, and improve officer and inmate safety. Now, there's a whole lot of line items here that I put underneath that topic. But basically, in March of 2020, when the COVID hit officially in the United States of America and was recognized by the president, then we had to scramble. Okay, I didn't have any field manual to keep COVID out of the jail. It was very hard. We had to talk to a lot of medical professionals. We talked with the commission. We had to get money to be able to take existing rec yards and turn them into infirmaries and holding cells. We had to take holding cells or take cells away from inmates and turn them into quarantine cells. It was very hard. The year 2020 was probably the hardest thing I've ever done in law enforcement organization. But we did it successfully, and we did it with only one documented COVID case in the jail. And that's up to about 2 weeks ago. So this COVID is going to be something, especially we can look at St. Clair County Jail right now. I think they're up to 60 cases. They had a spike come in about 2 weeks ago, and all of a sudden, because they had relaxed some of their COVID preventionary measures, I don't think I should say that. I don't say relaxed. I'm saying that we probably all relaxed at this time. But anyway, they've got an outbreak in their jail. We had to take some of their prisoners. We had to make sure that they tested negative and move them away because of their overcrowding, and of course, and there's people that have this, okay? And like the hospital director said, it affects a lot of people in different ways, especially if you've got lung issues or what have you. So this system does a lot of things that we can certainly tie into COVID. And I'll mention those three briefly. It'll provide a date timeline documentation to assist in contact tracing for inmate test positive for COVID. If we do experience a COVID outbreak, it's effective in creating a keep apart status and tracking quarantine timelines for managing COVID processes and operations. Now, what we came up with at Blount County Correctional Facility was the old charts and darts method. I got a whiteboard about the size of half that wall right there. It's got every inmate's name on it. It's got what cells they're in, which cells are quarantined, how long they've been in quarantine, who's got symptoms, who does not, and things like that. We've got it all on the whiteboard. These officers have to go in daily and take assessments with medical, and then they've got to update that whiteboard. It's outdated. It's not a good system. It's the only thing that we can come up with. This system right here does it automatically, and it does it as legal-based documentation. Reports are readily available to provide statistics and status to any outside agency, such as the Blount County Health Department, of information related to managing a COVID event. All right. There's a whole lot more that I could go on about COVID, what this thing does. But what this system really does, it does two things. It does the total automation of the jail management system. It makes the jail management system for Blount County Correctional Facility totally paperless. And it provides handheld devices for each one of our officers, okay? And these handheld devices have their work plotted out for them for when they come in at the beginning of the shift. So if there's a quarantine check to do, they will go to that quarantine cell, look in, bring medical if they need to, take that device and scan the barcode, and it documents the time, date, and action of what they did. Also, suicide checks, medical checks, any interaction that we do with that inmate, as far as care, custody, control, is documented legally at the time it happens and who did it and what was the results. Now, we've done our best to run a good, tight ship at that jail, but still in the past 3 years, I've been under 11 court actions. It's just, when you sign on to a role like this, you're gonna get sued. Most of them get dismissed, not all. But it's still a lot of time. You know, you have written depositions, you have court depositions. When you answer those questions, you have to be legally correct. They require a lot of research. I spend a lot of my time answering lawyers' questions, and not the good guys.
Thank you.
This system would totally automate all that. In booking alone, we're required by law, and the county is too, to maintain records. I just got a spreadsheet at the beginning of this week about all the records that we have down in this basement. What can we destroy, and what do we have to keep? We have a 40-foot building right now that's full of records that we have to keep. And then whatever we have to keep from here, we're gonna have to move it out as well. Inside booking alone, I would bet my paycheck that there's 50,000 sheets of paper just in those file cabinets. We can do away with every bit of that, this system. Now, this system is expensive. Liability reduction is great. Everything for the coronavirus, everything for medical, everything for mental health, everything for officer actions are documented. And then two, what it's gonna add to the jail as far as how we do things will be a game changer, just like the body scanning device from the CARES Act. That was a game changer for us, to go completely out of jail. It's gonna cost $60,000, and in addition to that 60, we will have to do a data dump from Southern Software. It's gonna cost 20. That's something that we would like to put onto the table. And you can read some of those notes. There's bullet points in there. And I also have a lot more with this system can make a difference. This system will put Blount County Correctional Facility in the 21st century. And to my knowledge, we may be the first department to go paperless.
Captain, as always, you're extremely thorough here, and we as a commission appreciate that very much. And we may have some questions about this, but I think your record stands for itself in having one case of coronavirus as prevalent as that has been. And so that's very much testament to the good job that you've done down there.
To our people and operations officers.
Yes, sir. Thank you. Commissioners, any questions about this item?
I got one question. The documentation, that you already got all the records, someone would have to actually hand scan them in?
No, sir. The records that we got now, all right, when they went before Southern Software, I don't know who they had, but they had to take that company's server and dump it into Southern Software. So ever since Southern Software has been here, I think maybe for either 9 or 12 years, everything's been input by a computer. So that $20,000 takes everything that's input by a computer and dumps it into GeoTracker. I'm not an IT guy, okay, so but that's how.
So the law allows y'all to throw away the hard copies.
Yes, sir. If, these are the parameters right here. The system has a guaranteed backup that has to be in the contract. All JMS data, a failover should the data center encounter a catastrophic event, and the system undergoes a security audits 4 times each year to include a Type 2 SOC audit. All right, those put us legally paperless, and they've got to have the cloud, and that's what they're talking about. They've got their own servers. But in case of a catastrophic event, then they have a hot failover that goes into the cloud. So, yeah, it's all there.
Basically, it's not a bad price when you're talking about your square footage you get back from the hard copies.
We ain't visited the basement yet. I can see what's down there.
We're doing a house cleaning, I'll tell you that, we've had to, so our archivist is doing a wonderful job in identifying those things that maybe can be disposed of to create much needed space here, so.
I have received my marching orders to make sure that this is done by the end of the week.
Was that from Miss Tammy?
Well, from quite a few.
She, okay.
including
Yeah,
the sheriff.
she's really working hard on that, thank you for cooperating with
Yes,
us.
sir.
Will this help on repeat inmates coming in?
Yeah,
Like it'll still keep their information and their history and background?
Right, that's, the way our system works now, it'll do that, but these repeat inmates come in, okay, but they come in on different charges, and recurrent offenders is probably 75% of our population. So, a problem that we have is that this Southern software that we have now, it's outdated, it's hard to input data, and if you don't do it correctly, then my office manager or the assistant office manager has to come in on second shift and correct all those mistakes, okay? And we cannot have any mistakes, it's legal documentation. If we have a mistake, it's gonna be a problem with the office down the road. So, under this system, you know, it's easier to use, it takes every page and highlights everything that has to be filled, everything that corrections officer has to fill. If he or she doesn't feel that, it won't let them go to the next page. So it's foolproof in the way that it operates. Same thing with the handheld devices. If you've got a suicide watch check in 3 minutes, it'll give you a warning. If you didn't go make that check at 9 o'clock when you were supposed to, then it's gonna tell you, you did not make this check, why did you not do it? Well, there was a 5-down Charlie. Okay, go make a check. Or I couldn't because I was on a detail. It gives the officers an alibi, but it also holds them accountable because we get busy in that jail. We got a lot of people in there today. I won't say how much, but, and there's a lot of medical actions, mental health actions. There's a lot of things that we have to do in addition to care, custody, and control. Feeding, washing clothes, whole 9 yards. These handheld devices will not only route their work, but it'll also document their work. Somebody in a medical cell says, well, you didn't come check on me in 3 days, and I need a form 1984. Well, yeah, we did. Here it is.
Any questions, guys? Anything further? Okay, you got a couple other items?
Yes, sir, if I may.
Certainly.
Okay, I'm gonna read this. item number 1 under patrol cars. I think because it affected us all. Due to the impact of the FY21 general fund caused by the government shutdown of the state for an extended time, BCS Sheriff's Office and all Blount County departments did not receive the monies that it would have in a non-COVID year. Okay? And the way it impacted us is we were only able to get 2 patrol cars this year, and we actually bought a 3rd from the pistol permit fund. The impact on our automotive parts line item for the budget is, the problem with it is that we're keeping older vehicles that would have been retired, now we're having to patch them up and keep them running. And what we're wondering is, can the cost of this, these fully outfitted patrol cars be provided under this American Rescue Plan? And our basis summary is that we were unable to get what we normally would have gotten from the commission in a non-COVID year. The general fund wasn't there last year, and we had to work with what we had. If we don't get 5 cars a year, then we're parting and patching and piecing everything, just to keep it running.
So the question there, Captain, is, you just stated in item 5 there, is can the cost be provided by American Rescue Plan? So
Yes.
we don't know that.
Yeah.
We couldn't answer that today, but you're raising a question, and that puts a question in our mind, and our legal counsel will be advising on that as we go forward.
You know, we would like to see that on the table if possible. If we can get monies for that, we need the vehicles. Everybody needs the vehicle. Every district needs the vehicle. I mean, it may be something that everybody could benefit from if it's permissible under this plan. And I'll put the cost for the vehicle under state bid and then what it costs to fully equip it. Okay, another thing, probably under the same item, I don't know if this can happen or not, but body armor and correctional stab vest. Okay, we're in need of new replacement body armor and stab vests. We also need 5 additional stab vests for the new wing officers. The body armor for the patrol deputies is $1,000. The cost of stab vests for corrections officers can be up to $800. It could be as low as $600 depending on the size of the person. And what we would like to know is, can the American Rescue Plan provide the cost of these items? We would like to keep that on the table if possible, if it's identifiable. And you guys, you men. Okay, the other options that we have is body and vehicle mounted cameras. I think the attorneys understand the absolute necessity of these. I'm gonna be honest with you, when these first came out, I was totally against it. I felt like it would change the way that we do law enforcement, or had to do law enforcement in certain situations. But after being under this body camera system for 3 years now, I think it is probably one of the better things that ever happened to the agency. It's a lot of complaints that would have had to take the time to be investigated or unfounded by the body camera. A lot of problems that may come up in our tactics, techniques, and procedures, they are identified by the body camera. Any need for remedial training is identified by the body camera, and any truth to any complaints is identified by the body camera. Body cameras are here to stay. We're having to buy those from discretionary funds, and we've got one fund or one entity that will pay for, I think it's a grant that'll pay for half of it. But what we're looking for is to get some updated body cameras that actually have good analog, good audio and video, and do not take an hour and a half for deputies to download after their shift. I don't think it's our server. I think that the body cameras that we have are outdated, and for them to download, if they work a 12-hour shift, they may have 6 to 8 hours video total on that body camera. Every contact that they make with a civilian, they turn that on. And we're glad that they do. And, but at the end of the shift, they gotta come in, download that body camera so that they can use it for the next day or the next shift. And that's taking up to about an hour to an hour and a half. Car camera systems are very expensive, but I think that they are worth the investment too, as far as litigation, anything like that. The ones that they have now look forward of the vehicle, and they also look in the back seat of the transport compartment wherever you have prisoners at. And the audio is spectacular. It's expensive, but that's something that we would like to put forward for the American Rescue Act if we can. I think the liability issues alone in that we've discovered is incredible. All right? Continue.
Yes, sir.
All right. DOC prisoners held by BCCF for the correctional facility. We have held and are holding inmates sentenced as DOC prisoners since March of 2020 due to the coronavirus. The CARES Act provided housing costs to maintain the DOC prisoners for the jail from 12 March 20 until 30 December 20, at which time the fund ended. We're still holding DOC prisoners for the state. Can the American Rescue Act provide the cost of confinement for these DOC prisoners as was done under the CARES Act? That's something that we would like to look at on this rescue. Next week I will be at the Alabama Jail Administrators Council. They have a meeting in Prattville, normally where the ACCA meetings are, and they may have more guidance on that. I'm hoping that we can do the same, just like we did under the CARES Act. That was a lot of money that we lost during the COVID time, and we're having to hold their prisoners. Once they're sentenced, they're a Blount County inmate, and then if they're found guilty for a felony crime that requires a DOC sentence, they automatically become their inmate. We're holding some of these guys 6 or 8 months. We would like to get the money for them if it's available. Last year, that money from the CARES Act, I think, totaled around between $60,000 to $80,000 over the period of the year. Jackie could probably tell more about that. But it was a big help. And then the last thing on this list is the courthouse and JPO thermal body scanner. Okay, this is not a body scanner. It's a device that's not invasive to the public. It would mount in the vicinity of the entry and exit doors, and it's small and shouldn't be an eyesore or a public attention gathering item. What this device does is, as somebody walks through the entrance, it's going to take a picture of their face, and it's going to say 96 degrees or 101 degrees. It's going to go straight to the deputies, at the CST deputies at the metal detecting stations on their audio, and they'll be able to tell when somebody's coming in here with the fever. That's how we tie it into Corona, and it's probably a good idea. I had an officer come in the other day that had 101, and we sent her home. She don't have coronavirus, but she's got stomach bug that's going around. But we don't need to spread it to the inmates or to the officers. We need everybody to work and all the inmates to be healthy. So that's how we tie this into the coronavirus. But the main thing about this is that it's also a counting mechanism that would assist first responders in the event of an active shooter incident, fire, natural disaster. It would inform first responders how much civilian personnel remain in the building. Probably wouldn't work for the employees so much, but it would tell us if this place caught on fire. It would tell the command and control center out there in the parking lot that, hey, you got 25 civilians that haven't come out yet. This device, I didn't put the cost in there, but I think
I gave everybody a copy of the quote that we got from Laser One. It's $8,615 each.
we would like to see this for the courthouse and the JPA.
Is this just one, if it's getting people going in and out?
It'll, you gotta put one at the entrance and one at the exit. It's a small camera, it's about like that. If it's up in the door jamb, or not in the door jamb, but right on top of the threshold, or right on top of the door, that's what it'd be looking down. Probably, if it's the same color as the door frame, it'll probably be lost in color. Nobody will ever see it. But we'll know who's coming in, we'll know who's coming in. We'll know how many times they're coming in. If somebody's coming in this place 4 or 5 times a day that don't work here, it's probably an issue. Probably doing a surveillance act. And then too, we'll know their temperature, and we'll know when they leave. It's a safety and security thing for us as the meetup, but also, it's a good idea to have the temperatures on everybody that comes in there, and tell how many thousands of people come in here a month. We would know exactly how many people.
Is it legal? I'm just asking the question.
Yeah, no, it's a
To
great
hold
question.
somebody back with a fever, if we ain't an emergency act from the governor,
Right now, during the COVID times, yeah.
yeah, during COVID time, I
But
understand
now we're
that.
not, or we're relaxed,
So we'd have to let that go.
but we could make them aware that,
Aware
hey,
of it.
you're sick, you got a fever. and
I know it's a
you really
weird
have to
question,
be
but
here.
it just
No,
concerns
it's
me.
a good question, and,
Yeah.
and a follow-up on that to me is you got, I would assume, have a dedicated server that's collecting all this information, and
Yes.
so is, because,
NVR.
you know, is that gonna be in addition to that cost, or is
No,
that
it's
part of that
included
cost?
on that quote, let's
It's
see.
probably one of those type deals that
Thermal
maintains it for
NVR.
10 days or 2 weeks and dumps it and, you know.
Suggestion channel.
Yes,
Okay, so that's part of it, okay.
In some of our, I'm not gonna say that, but in some facilities, the data dumps every 90 days.
Yeah. Okay. Gentlemen, if we got any questions, I didn't want to keep y'all too long this morning, and we got a few other things just to run down, but, Captain, you done a very thorough job and raised some good, points and good questions, and we'll all be seeking the answers to those questions as we move forward.
Thank you, Judge. Thank you for your consideration and the commission's consideration of these requests. Thank you, we appreciate it.
Thank you, sir.
I would like to say one thing too, though. You know, we appreciate St. Vincent's Hospital for what they do with our inmates. You know, I think that, the system that we're under right now came about between you and probably this man that was here. And that was certainly a lifesaver for the county, and we appreciate it. And anytime that we can keep our prisoners up here in St. Vincent's instead of Birmingham or UAB, it's a big deal.
Seems to be working well. The
Yes, sir.
emergency department, you know, we still always want to be careful that that's operated under contract by the hospital, and they have actually tried to seek some additional costs from the county, although we're paying the Medicaid rate as approved by the commission. We just kind of ignored that because we feel like that's reasonable, and we're doing that, and I think we're in good shape. But yes, that's worked out well.
Have nothing but good words for y'all and St. Vincent's.
Thank you, Captain. Gentlemen, if we go back to our little list and we kind of run down through here, we spent some time already about the broadband study. The only thing I'd add to that, once we get a proposal, since our meeting, I've been in touch with some state officials, and I think before we approve the study, we want to do a little further due diligence with the state, because they are actively looking at ways that they serve the entire state on broadband. We'll have those facts and figures soon. We spent some time there on the digital radio system. Rimlap Fire Department had a request, and Commissioner Washburn, could you elaborate on that? I think it has to do, say it wasn't a large amount of money, something $10,000 to $15,000 for, was it defibrillator? Defibrillator.
I think there's, I don't think it's in working condition right now. But I think it could be 20,000.
Okay.
And, you know, they'd talk to me, talk to you, and see what we could do on that. Like we said, we didn't know really what we could spend on it. So.
Right. So that's, that request has come in through telephone calls with Mr. Paul Gilbert to myself and to Commissioner Washburn. We did have a letter from, and again, we spent time there on number 4. Number 5, we did have a letter from the Community Action Agency that we are part of, that just says that through the pandemic, they've had a spike of requests for assistance for services they provide. Our Blount County Children's Center has asked that we keep them in mind. They largely besides what the county does pay to them, they largely depend upon some fundraisers they do through the year, banquets and things that they have not been able to do because of the COVID virus and the fact that we could not get together, and they asked that we keep that in mind. There was the couple of gentlemen from the Blountsville Utilities that came one day and stayed a while, and they're just looking for ways that they can drill and develop a new water supply for that area of the county, and they just wanted to run it at the flagpole and to say if there's any way that the county could help us on that, they would appreciate it. Their estimated cost on that fully developed well was $800,000, as I recall. Down in the West Blount sewer system, we know that the original design of that system includes some inline pumps to help decrease the pressure on the system from the school. That was not installed because of cost back at that time. And we know that continues to remain an issue, that some of the businesses that are hooking on down there have to have holding tanks where they pump out during the night because of the flow that the school system puts on the system there and the head pressure that they deal with. Commissioner Armstrong, do you have anything further about that? Does that kind of just cover, basically, I think we've been, yeah, we've sort of been aware of that. And so,
And I'll say this, some of the businesses that's on the school end, they have to have holding tanks, without grinder pumps, but during school, they have to pump at night, holding tanks, you know, just because it's getting, there's just so much travel to the lines there.
and then, so that's something that is requested, if there could be some assistance there. And then one of the items that I think is a huge item, that's the final one that we have not talked about, is the future of our courthouse building and where we go from where we are. That's such a huge decision and such a difficult decision. We don't know for sure at this point whether a substantial amount of this money could be spent renovating this building or be applied toward a new facility. We don't know the answer to that right now. I think how the money can be expended would really play into our future planning and decision about providing for our courthouse. What we do know is that there is something in the interim rule that says we can address ventilation systems. And so exactly what that means, I hope there's some further direction in the interim rule on that, in the final rule on that, because we know if we were to undertake to, with this money, to replace the heat and cooling system in this building, that there would be a whole lot of things that would be related to that, such as electrical and various things, and just the remodeling that would have to be done to make that happen. So would those items be covered? I think we don't quite know that. But Jeff, do you have anything further?
Judge, in the interim rule, there's a specific line item that says ventilation improvements in congregate settings. So that would fall right in line if what we have now is not really a ventilation system. It's a enclosed system. If we were able to incorporate that into maybe some kind of a clean air filter and all that along with and bring in outside air and improve that ventilation in this building, I think it goes straight to that line item. Now, I would also say that if there are ancillary issues to making that improvement, that would also be included.
So we'll be very interested to see what the final rule says about that. But
I guess you got 200 people on a docket call in a big courtroom upstairs. That's certainly a congregate setting. People got to be there. So.
Yeah. So I don't know. I just see legal expenditure because really out of 11.2 million, we could meet not all the needs that have been expressed, but we could meet some of the needs, and then further, do a lot of work to this building or another facility if it was allowable.
If we considered anything in this facility, we need to consider a new entrance to the building. It's not fair to there again, to the public. To go through this ramp in the front, I'm sure you get many calls a day, or have got calls, I get calls.
Business mostly. Mostly put their nose on the end of my nose.
Yeah. That they blame the commission for this, but it's really not the commission's
No.
fault.
Right.
But if this money can come about, it needs to be a better entrance to the building. Even we have to go into a contract with First Baptist to have some extra parking. If we move the museum down here, maybe tear that building down, increase some parking. There's lots got to be done to be able to keep this building here. You just can't let the real estate around the building keep the building to where it's at. It's possibly that a new building could be built. But I know we got to wait and see how it works and how it plays out.
Yeah, right. That's the question, but that's to me, and just to wrap up my thoughts on this, and encourage everybody else to express their thoughts. You know, we a few months ago would have never envisioned that we would have had this amount of money that we might be able to address some needs in our county. So to me, it seems really important, and I think I speak for everybody on this, that we identify what benefits our county as a whole in the greatest way that we can. And of course, you might say, well, doing something in the jail don't benefit me. Well, it really does, because we have to look at, we as a county population have to, through our tax and fees that we pay, we have to fund these things. And anything that we can do that meets these needs really helps everybody. I know communications helps everybody. Being able to adequately maintain our buildings and provide the most convenient ingress and egress to those buildings we can, that helps everybody. So from the very beginning, I'd hoped that we might identify 3 or 4 or 5 things that we could help the greatest number of people that we could, and center our attention on that and not get way out in the weeds of letting individuals or businesses apply for money that might be illegal. But, you know, individually, and our businesses have had a lot of help through the federal government already, and if we could identify what we think are our highest priorities and work with them, provided that our legal counsel will give us support that's legal to do, I feel like that's probably what we want to do. Gentlemen, do y'all agree with that or disagree with it, or what's your all individual feelings? I'd like for y'all to express yourself, if you will.
I agree that also, we found out earlier that there is probably some opportunities for some of this funding for roads. So I think till we get to the bottom of it, find out what directions we can go in, helping the hospital, I think it's a no-brainer.
I love that idea
The
myself.
quality of this,
I think that's
our
great.
county relies on the hospital we have here in Blount County, so that's number one. Number two, like you said, the Sheriff's Department, these items that they bring into the table are great items. I think it enhances people's quality of life here, no matter if you're using the jail and you're not using the
That's
jail.
right. That's right.
That's right.
It serves everybody.
So,
Yeah.
at the end of the day, I think all these are good. The Children's Center, all these are good requests, and I hope we can help every one of them. I hope we can fund everything. But at the same time, I know we're gonna be limited, but getting people in and out, government buildings to me is the most important thing, because the people, you've taken their time, and their time is very important. So it needs to be where they can get in and out in a reasonable amount of time.
Yeah, they're all good requests. I want to circle back to the broadband. I know we had a lengthy discussion at our last two meetings about it. Got to meet with Mike Rada this past Friday. He is now the representative for Tommy Turkville, so he come up Hayden. And he covers from Chilton County to right at Colvin County, and across both up the east state line. And that's his region. And he said since he's been out meeting people, that in the rural counties, he's figured out that's a pretty good problem. So I told him we'd voted to do a study, and when we got the study back, we'd come back to them and let them know what we found out, try to help us federal level. But yeah, all these are great requests, just, there's only so much money, so we have to see what we can and can't spend it on.
Let me note, it was, we received a fax from our Blount EMS ambulance service director, Mr. Wesley Powell. He wanted us to receive this during our meeting, and it's just a letter of support for helping with the radio system if possible. Okay. Any other comments about, we've got one other quick item I think we're going to deal with, but I think this has been a very beneficial and productive meeting. You know, in our regular business meetings, sometimes we just have so many items to deal with. You just don't, it's just not a good time for us to sit and talk a little bit about this issue. And this is such an important issue that I appreciate everybody's participation, and commissioners, I think this gets everything on the table, and I wanted everything and every conversation that I had had or any email or letter that come in the commission office, let's just get it all out there so that we can all be thinking about it and thinking individually what your priorities are as we try to move to the right decisions on that. So that's still dealing with item number 2 on our agenda. Is there any other thing should be said or would like to be said about item 2? If not, item 3 is discussed Rebuilt Alabama building reimbursement procedure. I'm not sure, Dustin, is that something that you need to speak to, or?
No,
As
actually
Commissioner
don't.
Armstrong? Okay, Commissioner Armstrong, you're recognized.
Of course, so far, this is our first go around District 1 and 2 with the rebuild money, and I've completed, well, I still like a couple of miles of civil service, but I'm almost complete. But going back and doing our gravel tickets, we have to get the receipt. They've got the PO that is attached to that project. When it leaves the commission office to be paid, one check is paying for 4 different districts, and it wouldn't matter what kind of system you're under, because you're still doing it on a project basis. So like, there's one check that goes towards several projects. So Miss Cindy Walker was here yesterday. I talked to her about it, 'cause she had so many years in paying, is if we could talk, if we work out with Miss Cindy Sell and Madison, and let's pay, when we stockpile, we pay those bills with one check on that PO and that project. The paperwork would be a whole lot simpler if it's not a big burden on her doing it that way. But Mark worked on some with the map the other day, and they've got stuff scattered everywhere trying to put stuff together.
You mean let me state, from my understanding, Commissioner, so you're saying that the PO would denote the project and it would be paid directly to that project?
Just with one check.
Right, any rock, we're stockpiling at the shop, or say the District 3 stockpiling for use for general projects, that would, she could pay them all like that. This would strictly be the projects with road number or road name number / whatever. And it simplify the reimbursement process, because Dustin can tell you it's a headache.
Each project needs a separate check.
Yeah.
So
That-
yes.
Let me just say, the only thing that would be a time thing for CDCL would be that as she entered that, she'd have to print the check right then, because anything she enters with gasoline fund 2, say Madison Materials, it's gonna come out on one check if she's doing consecutive enterings. So the thing would be, she'd enter it for, say, District 1, and then she'd stop and print the check.
And that's why
Right then.
Is it a problem for her to pick up, because like you saw about that one PO, we get that one PO for that road. It's there until we get completely, all of it handled.
Yeah.
But is that a problem for her to pick up that PO and saying that's that special project?
And it may be something where we gotta work out, Madison also put us on a 30-day billing cycle, where I feel like we
They
can
don't
stop.
send it till they're through,
Right.
for the month. Is that what you're saying?
Well, what I'm saying is I feel like I could stockpile, if I just put 2 guys on one road to stockpile, that I could be finished in 10, 15 days easily. And you know, if we put it on that billing cycle, that way that one check pays for that project, and then they'll move on to stockpiling for road X, so to speak. I just think it's simplified on the back end of reimbursement, because we're under auditing purposes on that for the state.
Yeah, and I want to speak to that. So we're only a handful of counties, a couple of counties that are doing it this way. Most counties are taking this money, hiring contractors, and making that a project. It's easy to account for that money. As a county, we've never been under this kind of reporting requirements for any fund we've ever had. So it's a learning process that we're going through. So I just hope the commissioners won't get frustrated with it, because we have a contractor report that's due, we have an annual expense report that's due, we have a county transportation plan that's due, we have a compliance report that's due, and we were just audited for our first year of Rebuild Alabama, which we're being audited right now. But the things that she requested were the expense report, the transportation plan, the compliance report, and she asked for our bid contracts. So she wants to make sure that everything that we have spent from that fund had a bid with it. So that's what I'm trying to track, and our department, Karen's trying to track, is we're trying to track to make sure that what we spend out of that fund had a bid associated with it. And that's the law.
Well, it's
So,
much like they won't reimburse you for anything you don't have a bid on.
that's right.
Also on the Rebuild Alabama though, when they go through those bid, they make sure that each one of those tickets add up to what the bid was, because we've got some mistakes, I believe, in ours when we did ours and, you know, last year.
Right, and each district, you know, has through the years done it differently. So it's not so much that we're trying to make everybody do it the same as we're just trying to figure out the best way, simplify it for each district. So, and each of you want reimbursement for different items, some for emulsion, some for pipe, some for rock, so and that's different suppliers, so it's different.
And we put our pipes in different kinds, so that's really not a big issue. Ergon is not even really a big issue, because we might next year when we get the new equipment, two districts be paid at one time.
Right.
But that's still pretty simple, that's just two. So this gravel is the biggest issue, so.
Sounds like whatever can be worked out, you're comfortable with the reporting process.
Yes, sir, everything we've done so far has been right on, you know, on par, and everything's added up. So we haven't had any issues,
Right.
It's just trying to get the most simplified system.
Yeah, like I said, I walked in on Martin and that last week, and the board, it was like my desk, because they had stuff stacked everywhere. And, they was elbow deep in it.
So would you be comfortable, Dustin, with what's being suggested
Yes,
as
sir.
a PO system that?
It's not the
Yeah,
PO
it-
system.
we already have
It's
the-
It's the invoice, it's the
Yeah, we already
invoice
have
system
the invoice.
from the supplier.
That's part
We
of the
need to be
issue.
able to separate it by district from the supplier, that's the most
I see.
important.
Well, not really just
Separated
district,
by the
project,
PO.
Project,
yeah.
project,
By
number,
project.
really, not even district,
Well,
just
the
that project.
deal
number.
with District Two, there was two different people, some were stockpiling, might have been 67, some 78. Well, all that was on one thing, but it was like, one of y'all's had 4 roads on it. Well, you had Mount Hebron, then you had Smith Road, you had County 30, all on one invoice. So you had to go through and you had to mark, and you had to look at the little, if you could just say, Tuesday, all we're gonna do is County 30. You know, if you do that, that invoice from them would come in, because those tickets are, all have sign-ins that we can pull the load tickets. So when CD gets that invoice, like we've done, you upload, if they upload it, she'll upload that invoice into the Google Drive that Dustin had set up. You take that invoice and you've got your tickets, and you can match that together. You can put that together and send it to her and say, hey, and that would be that road, not try to do stockpile each one. I mean, like
Yeah.
all of them, in 1 week, you will have 5 roads. Designate one day
Right.
to that truck driver. And don't do multiple POs. You open that PO when that project starts, and when that project finishes, you use that same PO.
Right.
And they will do that, because that's what we set up, that's what I set up when we first started doing this
last year. I went in and I got everybody a PO and showed them and said, this is, this is what we're gonna do, and that's what, they were good with that.
But now, we do have to have a separate PO for each
Yes.
project.
Yes,
Right. So-
but,
Yeah,
I mean,
each
that's
road.
something you would,
Yeah,
For
each
each
road,
road.
yeah.
but see, then you have your monthly PO too.
Mhm.
And, but your truck driver's got to, I think Tammy done her little thing for the
Right.
guys. I told her, I said, do a little thing, give them a little thing that says, this is
Yeah.
what you're doing, this is your PO. I said, that'd be the easiest thing.
Yeah, I think for us, we're gonna send a plat, we're not gonna stockpile here one day, and there the next, unless they're just not running, say 67. They're only running 78, that'd be the only way we would.
But if you do, but if that 67 and that 78 was for that road, just keep doing that road.
Right, that's what my plans are from here on out.
I think
What she's talking about right there though is like, I had them stockpiling for Smith Road, whatever. Then I had to call them off, at a certain time during the day and bring me a load of crushed run on a different road where I was working.
Right.
So there,
And
then
there you go
that
back.
day, they had some Smith Road, some Roswell Creek Road,
Oh, yeah, you're gonna run
the
it.
same truck driver. So that's where that came in.
Yeah.
But you could still distinguish it better if you were paying one district
Yes.
with one check.
Yep.
Yeah.
Even if it's got some intermingled stuff, it'd be
You can do
easier to
your,
pick
you can do
through.
your stockpile PO for the month, what you're gonna crush
Mhm.
run, whatever, and then have your project PO separate. I think
But
that's-
still separate the tickets with the check
Check,
is
that-
is what's critical
Yeah.
on their end.
Yeah,
Yep.
it makes it a headache.
And I think we're about to have to adopt the transportation plan for next fiscal year in August. And my plan, I think this will work better, is if you have one project number for each district. So if you have 5 or 6 roads that District 3 is gonna do, or District 2, if we have one Rebuild Alabama project number for that, I think we could account for that better. I mean, y'all agree?
You
That-
know,
Oh, yeah,
three
we
roads
can
on
do
one
that,
project.
Yeah, we can do that. I didn't do that
Well,
originally because we didn't have as many roads as the districts were doing. They were doing one large project. But if we're gonna do smaller projects, I think we could just add them as one.
That's what we got into the Ergon, PO, we was having it, because you're not gonna have a
Can't break
perfect
it down.
day where 3 tankers is gonna lay down that road.
Right.
So Dave was having to keep up with it and put it, like I say, 1.5 mile road, and we had this half-mile road here, and put them 2 projects on one PO.
Right.
But he separated the gallons.
And Dave did really, really good.
So Dustin, what you said earlier was we were in the learning process.
We are.
So I think anything that you and the commissioners and the commission staff work out that makes it work is good. And
Yes.
I don't see that we need an action on this.
I don't think
item.
so, I just wanna make sure, everybody's on the same page.
Try to keep
and
working
try to-
together and make it better.
As long as we're not putting a huge burden on, the office staff doing it this way, and I don't think we will.
Well, I think if it's clearer, it helps everybody in the long run, because when the auditors come back and ask us to pull, it just
Yeah.
makes it easier for everybody in the long run, even if it takes a
Yeah,
little
because
bit
like
longer.
now, the auditors, when they go through these tickets, it's gonna be.
Mhm.
Yeah,
I think multiple roads on one project be, if you can do that.
Yeah.
You
that's-
can.
It'll be a lot
that's
easier.
simple that too.
yeah, okay.
Because you can do 2 or 3 roads in one area, then you got 2 or 3 roads in another area.
Yep.
And put all in on one project.
Okay.
That'll simplify it too.
And this upcoming year will be the full 10-cent implementation of the Rebuild Alabama tax. So it'll go to District 3 and 4. So that was projected to be about $1 million. So I'll get with you and see if we're on track for that. This past year, I know COVID hit a snag with that.
24 is where it's going. I try to stay with one road, with the long miles.
That's good to get up
But
to that.
I'll be getting with both of you guys and see which roads y'all want to put on our plan for August.
Well, I think we've had a very productive discussion today, and it just kind of lets us know where we are. The fact that we did not choose, and I think this was the right decision for our county, we did not choose to participate in the ACCA program that is expired, and I understand that program's going forward with some 30-some-odd counties who did participate. And if that works good for them, I think that's fine, but for us, I think we're doing the right thing. So Jeff, we're just gonna really count on you and Scott to continue to monitor the rules and.
So don't screw it up, is what you're saying. No problem.
So, if anybody got any wrap-up statements that you need to make before we adjourn?
We're gonna be like James Hill, we just gonna give good advice, not
Okay.
bad advice, what James always says.
Anything further? If not, the chair would entertain a motion to adjourn our meeting. Motion second, all in favor, please stand, and thank you for being here. Commissioner, about that.